Hello everyone, my name is Aidan Friederich and I am a graduate student in Biomedical Engineering at Case Western Reserve University. My work is done through the APT Center at the Cleveland VA. I work primarily with people who have a spinal cord injury. This often results in paralysis below the site of injury, requiring permanent use of a wheelchair for mobility. As a result, they spend a lot of time seated. As you all know, especially working at a desk all day, your seated posture is extremely important both for comfort and functionality. I bet you even sat up straighter at the mention of posture. Imagine being unable to do that and being permanently in a hunched position because those large back muscles are paralyzed. This makes it really virtually impossible to lean forward to grab something off your desk or lean to the side to grab a package off the ground. And really, current solutions only work to constrain the individual in one upright position by locking them in place with restrictive straps and pads. This position then limits their range of motion and does very little to restore functionality. Here at the APT Center, we have been developing a soft exoskeleton that the user can wear around their torso to ease seated movements by providing a passive restorative force without restrictive motion. So here you can kind of see the exoskeleton. It wraps around the torso. This is an early prototype of the design. And then embedded within the exoskeleton are these flexible rods so that when I bend the exoskeleton, it returns back kind of to its original place. And that's because of these flexible rods that I can just pull out of the exoskeleton. And these, when bent, they want to return to that function. So when you're bending the trunk, these provide kind of a restorative force just to help those people out. And the exoskeleton is innocuous enough that it can be fit underneath the shirt, and then it's highly customizable because you can just insert and remove these rods at will, either by the clinician or by the individual at home. So really the next steps are to test the comfort and efficacy of the design with able-bodied individuals, and then move forward with people with spinal cord injuries. Looking to the future, I really imagine integrating this design with my dissertation work around functional neuromuscular stimulation of the trunk. And overall, we really aim to improve the user's seated stability and movement so that they can more easily perform activities of daily living and improve their quality of life. This has been a side project that I've been working on alongside my dissertation at the VA. And the VA and APT Center have been incredibly supportive, even awarding me funding to develop the prototype. And I've also recruited an undergrad, Nick, from Case, who helped with every step of the way. Throughout the process, I've also leaned on a network of clinical expertise available to me in the APT Center, including physical therapists, prosthetists, and gaining valuable input from, of course, the people with the spinal cord injury. Okay, well, thank you. Have a nice day.